chiropractors are kind of in this awkward stage where, the option of getting a loan and getting your own practice and do is not maybe on the table for them. And so they start off working in different arenas. Some of them are working corporate offices. They're the corporate chiropractor. Some of them are working in multidisciplinary offices, which is probably where a lot of them are going to end up going. Like I work in a multidisciplinary pain management clinic. I love it. I love working with other professionals. I see things that I would have never seen in my office, and I learned from people things that I would have never learned. And some people are being patient advocates. They're out there kind of helping, be the conduit between the medical doctor and the patient because, man, we get patients. We're all heart, and sometimes putting us, as the interpreter does great things. So the roles of chiropractors are changing. And yes, we're evolving. I mean, we have this boomer population, and they're not getting any younger, or their joints aren't at least. And and if you've ever met, if you met, especially if you have parents that are in this group, they're living longer. And the life expectancy at the turn of the century, I think, was about 46 years old. It's actually my age, and you know, you died before your joints did.
Right.
And now we're kind of running in this situation where we got a bunch of people and their joints are running out, even though they have a lot of life in them. And they're like, well, I want to keep doing things, but they don't want to rely on drugs. They don't want to they don't want to rely on surgeries. And so they want something. Can you reduce pain naturally? And if you can be that person who serves that need for this population, just wants to stay active, keep living their life, but wants their bones and joints to be a little less painful, or a lot less painful than they would be otherwise without drugs and surgery, then man, you're going to serve a big population. There's a demand for that. That's where the demand is at, reducing pain naturally. And man, if chiropractors can get good at that, get focused on it. And if I know there's the wellness guys out there going, hey, I don't want to chase pain. That's fine. But pain is bad for your health. Pain is bad for your health. It's bad for your mental health. It's bad for your physical health. I mean, if you've been to any chiropractic seminar, nociception leads to increased sympathetic tone, which increases the stress response, which means a lot of bad things. The immune system goes in the dumper, digestion, metabolism, mental health, it all goes in the dumper. So if we can reduce pain, the evidence is there, folks. If you can get people out of pain, you're making them healthy. I think being a pain management doctor is being a wellness doctor, and doing dry needling, integrating chiropractic. There's no other, I know I'm long-winded on this, but there's no other profession. Like, I'll put it this way. When I had disc herniation, what I wished was that I could go and get an epidural right away because I was disabled. I mean, I couldn't do anything. No adjustments is going to help this, right? And I wish I could get an adjustment, but then get on decompression. And then get a physical therapist that knew good core workout and could kind of bring me back to life all in one place. But you can't. That doesn't exist. You got to go get the pain management to get the injections so you get a little bit of relief. And then you got to go. And then if you have a good chiropractor, you got to find one that's decompression and is a good adjuster. And then a lot of times that chiropractor doesn't know how to do a core rehab program, or isn't, or maybe he's too busy, or it's just not in it. And then there you'd have to find no more. With dry needling, you can be the pain management. Because you put the needle in the spot, and that does a lot of the heavy lifting according to the evidence. They call it placebo effect, but they don't realize it's just that the needle is wildly effective. And then if you're a good chiropractor and you're a good adjuster, and you have just a modicum of rehab experience and knowledge, you can be all three in one, and there's no other profession on the planet that could compete with you.
Well, I think there's a lot of people listening and watching that are definitely interested in learning more. So what's the easiest and best place? What are some of the courses that you have available, and where can docs go to find more of?
I teach primarily in Arizona and in Texas, but I am real, I wherever people want me, I will show up. If you have dry needling in your state, I love to come out and teach a group of docs. I've done it for everywhere from 2 to 20 docs. It just, I want to go and I want to help these doctors grow and learn. I want the profession to help more and more people. I have an extremity class and a spine class. And so we have a whole 2 days of just spine, and then we have a whole 2 days of extremity and TMJ. And then we talk about the rehab for all those things. We talk about the physiologic basis behind the efficacy of dry needling. You can go to chironeedle.com. That kind of has our scheduled classes. You can always reach out to me. I'm real grassroots. If you want me to come, I'm like, I feel like we're a touring band sometimes. Like, hey, let's go to Poughkeepsie. What's up, Iowa? Let's go wherever it's legal. I'm trying to get into. We're trying to look at Colorado right now. Just, I'll get on a plane with my gear and just you sit down and man, it's a technique class. So all I need is a bunch of docs that are willing to hang out, still excited about chiropractic and pumped, want to eat, hungry to learn something new and get together like we did in Technique Lab where we all hang out, we learn something new. Because I tell you what, nothing's more boring than going to a technique or some sort of seminar for hours where you just sit and watch a PowerPoint about how if you buy this thing, it's going to do a thing. Nope. I like to use your hand. I want to do stuff. I'm a doer, and I want my chiropractors to be using their hands and their brains to help a lot of people. So that's kind of that's kind of where I'm coming from, and you can tell I'm just super excited about it, and just I want to come everywhere. So chironeedle.com. You can see us on Instagram as well, but or you can always just reach out, and I'm happy to talk to you. Those are some resources.
I absolutely love it. So docs listening and watching, if you're interested in dry needling, or maybe you're still not even sure about dry needling, but you'd love to have an affordable, effective, and powerful tool to add into your practice, I'm going to encourage you, check out chironeedle.com, connect with Dr. Aaron and his team, and get coached up, get trained, and add something into your practice that gives you a new avenue to help people, that gives you a new avenue to communicate, and also to deliver the highest level of patient care possible. Really appreciate you coming on and chatting today, Aaron.
Hey, thanks, Dr. Jeff.
Thanks so much for checking out that interview. If you liked it, we have plenty more available. You can check out the next interview right here.